Welcome everyone to the first national webinar of the year. I'm Carrie DeVore, your host for today, co-host actually, and I couldn't be more excited. Today's topic is tips for general election period and Medicaid. And today is very special because we do have a special guest who's going to walk us through very important information. Some of it may be very new to you, and I'm so excited to be able to share it with you. We are going to go ahead and get started. As we're starting, I just want to give you a couple of little housekeeping items. Because this is a large-scale national webinar, we do record these sessions. We make them available after the session for those who have registered. So we always encourage you to register and be part of our topics. We do host national webinars every month. They're typically on the last Wednesday of the month, and every month we have a different topic. Obviously, at Fidelis, we have a lot of other things that we offer throughout the year, but we want to encourage you to take advantage of especially these national webinars. They often lead to great discussions and opportunities, and we're glad you're here. I do have my great friend, Marisa Knold. She is our director out of Colorado, and I'll show you the areas that she supports and covers and helps connect in here in a moment. Marisa, if you'd like to say hello.
Good morning, everybody. Thank you, Carrie.
Perfect. Marisa is going to be monitoring the chat. So all through today's session, if you have questions or comments that you'd like to share, we encourage you to do that because Marisa will be on top of the chat. She'll make sure that you are heard, and any answers that we don't get to live on today's session, we will definitely follow up in an email. So it's a great way to interact. So for today's session, hold on just a moment. We are going to, for those of you who are brand new to Fidelis, I'm going to give you a really quick overview of who we are if you're not yet familiar. And then I'm going to turn the session completely over to our special guest speaker, Manny Felix, to talk about today's topic. And then we'll come back and just talk about how to connect. If there's more that we can do to help support you and help you as you're growing your business, that's what we're here to do, and we're happy to be part of it. Thank you for joining us. As you know, Fidelis is here for you no matter where you are in the nation. We saw that in the chat a little bit today. We do support agents and agencies across all 50 states. So while we do have an office right here in Arizona, that's where I'm speaking to you from. Again, I'm Carrie DeVore. I'm the sales director here out of Arizona. I have the great privilege, opportunity, and responsibility to help all of our agents and agencies in California, Oregon, Nevada, Utah, Iowa, and Illinois, and of course, Arizona. It is such a great privilege because I do get to connect all of our agents and agencies with our local support teams in all of these areas. So if you happen to be from these areas, I would love to talk with you after today's session. I don't do it alone. I have my assistant director, Ricardo Perez. He has joined us and is part of our support team. And then also, you might notice on the map of the United States, all of those areas in the lighter blue shade, they are covered by my dear friend, Brad Woolard. He is our sales director, primarily working out of our New Mexico office, but he does serve all of those states and make sure that all of our agents and agencies are well connected. As you travel over to the East Coast, you've got our great friend Nick Santmeyer. He is the sales director over all of the East Coast, and he does a great job making sure that everyone is connected in those areas too. And I've already mentioned our dear friend Marisa Knold. She is the director out of Colorado, and she serves all of those northern states that you see in that deeper blue, almost purpley tone. And we're so honored to have her. And I haven't missed Bernadette Russo. She is our national sales director. She covers the entire nation and oversees to make sure all of our agents and agencies are well supported. It's really important, you know, that when you choose Fidelis as your FMO, you're getting more than just contracting support. Of course, we do give you access to over 170 carrier contracts that we have access to, but we also are proud to offer multi-product support, proprietary training, industry-leading tools that if you're not familiar with them, please reach out to your sales directors. We're always happy to walk you through things that are really here and available to you to help you succeed and help you as you're growing your book of business. We have an entire dedicated team to help you grow. Our approach isn't just one person supporting you. We have an entire team of people to support you. So if you're not yet plugged into all of the Fidelis resources, please reach out today. After today's session, we're all here to help you. You'll notice on every slide that we have here, there is an email address and a phone number. We're always happy to help you. Also, at the end of today's session, there will be a download in the chat. It will be that map and the sales director information that you see on the screen now. So I encourage you to just make sure that you're fully connected and taking advantage of the resources that are here to help you. And with that, I am so honored to turn today's session over to our guest speaker, Manny Felix from Blue Cross Blue Shield of Arizona. He does lead the Medicaid sales division. I have to say this, and I know that we shouldn't use nicknames or things like that, but in this industry, Manny's often referred to as Medicaid Manny because he's such a great resource. And today, while Manny normally talks about the Arizona market that he serves, he's actually going to talk about things that impact us across the nation. And I'm so honored to introduce our guest, Manny Felix.
Thank you so much. Thank you so much for the kind introduction. I want to thank all of you for attending this session and the opportunity that we have here with Fidelis to be a part of this training. Now, I always like when I do trainings, if this is the first time you've attended one of our trainings, I always love to answer questions. So if you have a question, do not hesitate to reach out, and then we'll answer those questions. Now, are you guys able to see my screen? Hopefully you guys are. Someone could say yes or no on the chat. Perfect. All right. Yes. All right. Awesome. All right. So as agents, it's one of the things that's really important as we talk with everyone that we encounter on a day-to-day basis, whether you're in California or you're in Arizona or in Chicago or New York, wherever you may find yourself located. It's really important to develop a connection with your client. I'm not just selling them the benefits of XYZ health plan, but I'm actually trying to find a good fit for them. We're getting a commission for their enrollment, but a lot of times it's not about just the commission. A lot of times I hear agents that say it's not a lot about the money, but it's about helping someone and helping them understand what they're enrolling in, and more importantly, who you are, the service that you're providing to them. Because at the end of the day, we want someone to say good things about us, and we want them to refer us. And so one of the things I'll be touching today will be about Medicare Part D, because it impacts everyone. This is something that we hear a lot, even though it's January 1st. A lot of you this whole month were getting calls from your clients about certain medications that were not being covered, issues that they're having at the pharmacy, because everyone pretty much takes some type of medication. And this is the one part that I feel a lot of agents can benefit from. Now, one of the questions that we always hear about when it comes to, LIS or even the state, all these different programs, is that a lot of folks don't know what they are. We hear these questions like, what are prescriptions, what are the prescription copays for those enrolled in LIS? Why are they paying copays? I hear this thing called State Pharmaceutical Assistance Program. I'm not sure what that is. How does that impact your member? I've also heard agents tell their clients, no, because you're enrolled in Medicare, you're no longer eligible for the State Pharmaceutical Assistance Program. We also hear times too, also we hear, why are my clients being charged copays? I thought because they had LIS and they had Medicaid, your plan said that there was a zero cost. Why are they paying these copays? And one of the questions that we always get is LIS the same as Medicaid? I have someone that is eligible for Medicaid. I think they're eligible for Medicaid, but I don't know what level of LIS they have. So we'll be talking about all those questions, and hopefully after this session, we'll be able to answer all those questions that you might have. Now, I always like, because a lot of times agents get started in this at a later time and they're having to play catch up. And a lot of times it's very frustrating because you really don't understand what all, yes, you got certified, you understand what Medicare Part A is, Part B, Part D, Part C, but a lot of folks don't really understand, how it all came to be, so I always like giving a refresher of what occurred and how it's occurred. So one of the things that I always like talking about is that, original Medicare. A lot of folks do not know that original Medicare did not include Medicare Part D. Now, original Medicare started back in 1965. It was signed into law by Lyndon B. Johnson, in which created Medicare Part A and Medicare Part B. It also created Medicaid as well, to provide assistance for those individuals that had limited income. Now, when you look at Medicare in general, there have always been some type of improvements through the years. And so, if you look at when original Medicare started, it had no Part D. So folks had to pay for their prescriptions out of cost. Now, you also had in in 1972, when Medicare expanded and now it included those individuals that had disability, that also, permanent disability. It also included those individuals that had ESRD. Those folks were included, and so folks that were not under the age of 65 became eligible for Medicare. And then in 2001, we also saw another expansion. We saw now that Medicare now included those folks that had ALS or Lou Gehrig's disease. If they had that, they were also eligible for Medicare. And then one of the biggest impacts was in 2003 when you had the Medicare Prescription Drug Improvement and Modernization Act, which now created Medicare Part D. And so, within the last 4 decades, there have been so much expansion from what we knew as original Medicare. And this is something that's really, really important, because when you're talking to your client, you're able to show and share with them that, you know, as the years go by, there's always improvements in with this particular program. If you're talking to someone that started back in 1965 when Medicare started, they would have been like, "Oh, let me tell you of everything that I've been through." But that's something that's really important to know. Now, when the Medicare Part D program began, it became effective in 2006, and unlike original Medicare, Medicare Part D was provided only through private plans. So someone can have original Medicare Part A and Medicare Part B, but in order to get the Part D, they have to enroll into a drug plan in order to get those prescription covered. Now, Medicare beneficiaries usually pay outpatient, prescription drugs at either a retail, mail order, or home infusion, or long-term care facility pharmacies. Now, because of this act, you now had the low-income subsidy extra help that was created. So, Medicare beneficiaries that had limited income were eligible for this particular program. Now one of the things that's really important to note is that as we've seen these improvements as Medicare, we've also seen improvements when it comes to prescriptions. And one of the things that we see, because there's so many, technology has been advanced so in such a way that we now have some prescriptions that, some drugs that were not created years ago. Now, with those drugs, those prescriptions, or how you hear all the time how as they're labeled as specialty care medications or specialty prescriptions, they come usually with a higher cost. Now, I want you to think of this next question. Do you know that how many Medicare beneficiaries leave their pharmacy counter without paying for their prescriptions because they just can't afford them? They need it. they need these prescriptions. They have to, because of their medical condition, they need it, but they're just not able to purchase them. And it breaks your heart, because they just walk away. Some of them will cut it in half. Some of them will just do without, or they'll just say, it is what it is. I can't afford it. Either I buy food, or I just get my prescriptions. And a lot of them will say, I'll just do without it. But that's something that's really important to know, because of how one of the things that you hear a lot, is that, I can reach out to the manufacturer, hoping to get a sample, or getting it covered, and it can be very difficult. But these are questions that these are scenarios that you may encounter as an agent, and it's something that's really important to know and try to provide a solution. And we'll be going over a little bit more about what LIS can do, and also some of the additional programs that our eligible members can be eligible for, if they're eligible for these programs due to their income. Now, one of the things that we saw last year was, we saw what was created was the Inflation Reduction Act. I don't know if a lot of you remember hearing about that, but that was signed into law in August of 2022. And many of those provisions began on January 1st of 2023. Some of the things that we saw was zero cost for vaccines. So pneumonia, COVID vaccines, the shingles. Shingles is kind of tricky, though, depending on the manufacturer. But a lot of these beneficiaries were able to obtain the zero cost for the vaccines. Some plans may have like a higher cost share for them, but in all reality, they should be getting these prescriptions, these vaccines at a zero cost. We also saw a $35 cap on insulin. Insulin is something that a lot of beneficiaries can go into the donut hole. um, and one of the things that we also saw with this reduction act was that it also eliminated the 5% catastrophic coverage. So when folks had to pay catastrophic cover, that 5% catastrophic coverage, that was eliminated. And one of the things that also did is it also eliminated the low income partial subsidy. So when folks were in level 4, meaning their income was at 136% of the FPL, up to 150% of the FPL, and they had, I think a lot of you may remember, they had to pay the deductible, and then they had a 15% co-insurance. And a lot of times it was very difficult for, when you're meeting with the client, to try to explain that to them, that 50% of this particular medication is going to be this, or it can change. So one of the things that we saw with this is that it eliminated that partial subsidy, and I'll touch a little bit more later on when we get to that section. Now, what is LIS Extra Help? We get this a lot. I don't understand LIS. What is it? How can I apply for it? What does it do? So LIS is a federal program for Medicare beneficiaries with limited income and asset that pays their monthly premiums, deductible, and also coverage gap expensive. So if someone is enrolled in LIS, you hear a lot of times about folks getting into the donut hole, they would be exempt for that if they are enrolled in LIS. Now, beneficiaries in LIS Extra Help, they pay very low copays, or no copayments, depending on the plan that they are enrolled in. Some of our carriers, some of the carrier partners or SIM carriers, have decided to go or participate in the VBID benefit. So if someone is enrolled in LIS and enrolled in one of those programs that is offering VBID benefits, usually their prescription costs are a zero copay for generic as well as for brand. Now, if a member has if they have a plan premium, the LIS will also pay for that premium, as long as they're under the state's benchmark amount. You always see some folks that are original Medicare. They have Medicare Part A, Medicare Part D, and sometimes they're enrolled in a standalone prescription drug plan, but they don't know how that occurred. Well, if a person is under limited income, they are auto enrolled into what's known as a benchmark plan, meaning a plan that has a premium, has a monthly premium that's below under the benchmark for that particular state. That's something that you normally will come across as an agent. You'll come across that sometimes, especially if you're working with folks that are enrolled in Medicaid. They will more likely be enrolled in a standalone prescription drug plan. Now, if you have any questions, please don't hesitate to ask questions. We'll be more than happy to answer those questions for you. Now, for 2024, remember how I was telling you how, well, for 2024, the new income limits have been increased. The new income limits will be released tomorrow as of February 1st for the FPL and all the different programs, but you guys are getting this first. So for anyone whose income is below $1,883, if they're a single person, so if they're not married, or if they are married and their spouse is not receiving Medicare benefits, they are eligible for LIS as long as their income is at under $1,883, and if their asset is below $16,600. If they are married and both enrolled in Medicare, the income limit for 2024 is $2,555, and their assets have to be under $33,240. Now, one of the things that's really important to note is that there are certain states that an individual, and we'll talk about this later on, where a person can be eligible for LIS, and even if their assets exceed those asset limits, and we'll talk a little bit more about that when we get later on in the presentation. Now, one of the things I forgot to mention about these amounts that I just talked about is the $20 income disregard. So a person can earn a little bit more than the amounts that I just quoted you, but I always like to separate it so that way, you can always, because it can be construed, because I've done it in the past where I'll enter the income disregard and then someone enters another $20 income disregard on top of that, in which it makes them ineligible for the programs. Um, Now, one of the things we want to cover too is, what are the LIS levels? What does it mean? Everyone, there's a lot of carriers that have tools in which an agent is able to see what type of LIS level they have, and so, one of the things we hear a lot is, how do they determine the LIS level? What does that mean to my client? How am I able to explain it to them? So if someone is enrolled in LIS, they will have, so for example, LIS level 2. So someone enrolled in LIS level 2, this means that their income is at below the federal poverty level. So that means that their income is below what's known as QMB. Now for 2024, for the QMB income limit for a single person is $1,255. For a couple, it's $1,703. So if that person is below that income limit, they are eligible for an LIS level 2. Now, an LIS level 2 is also eligible for Medicaid. So that's something really important to note. Now, there are some states that have higher income limits for Medicaid, such as New York, such as Hawaii, Alaska, just to name a few states. But that is something that's really important to note. So those states a lot of times have, like for example, New York, someone whose income is at 150% of the FPL could be eligible for QMB. So that's something that's really important to note. Now, one of the things too that's really important is that they have this level, this LIS level is usually for the entire year. So so if they are LIS level 2 as of January 1st, more likely they will be LIS level all the way to the end of the year. There are some exceptions, when something happens that they move to another state, but for the most part, this LIS level is for the whole entire year. Now, the next thing that we always hear is, what is LIS level 1? Now, LIS level 1 means that someone's income is below, is below 1,055 and a penny, all the way up to $1,506 for a single person. For a couple, it's 1,703. and a penny, all the way up to $2,044. That's someone who will be eligible for SLMB, and they're also eligible for the Medicare Savings Program. Now, in this particular scenario, their co-pays will be either $4.50 for a generic or $11.20 for a brand name prescription. If they are enrolled in a plan that's, so for example, like I was telling you earlier about VBID, there are some plans that if a person is, because I hear this all the time, because our plan has a VBID, it participates in the VBID. So we may have someone that has an LIS level, and we always hear agents that will say, well, why is there a zero copay? It's because of that reason. But this is something that's really neat, is that they are eligible for the Medicare Savings Program. So their Part B premium can be paid for by the state in which they reside in. Now, the other program is is QI1. QI1 is those individuals whose income is between 1506.01 and so $1,506 and a penny, all the way up to $1,694. So that
Hey,
means that their
Danny.
income is, yes.
Sorry to interrupt, but I just wanted to let you know, we do have a question in the chat.
Okay.
And Russ is asking if a spouse isn't on Medicare, is their income included with the person's who is?
No, it's not included at all.
Great.
They are excluded.
All right, thank you.
You're welcome. Yeah, that's something that happens a lot, unfortunately. And because of the redetermination, and just so you know, depending on what state you are in, the redetermination may be ending as of April, or it may be ending as of June, at the end of June. So we're going through. A lot of states are still going through the redetermination. Arizona was one state that decided to go within 12 months. To go through the whole entire redetermination. Other states elected to take 14 months to go through that. But that's a very good question, Russ. Now, someone that's in LIS level, LIS level 1, is like I mentioned, is eligible for the Medicare Savings Program. Now, the next one is really interesting because we talked about the different LIS. So we talked about LIS level 1, LIS level 4. So remember how I was talking to you guys about the Inflation Reduction Act. This is the one that's going to have probably the biggest impact. So if you're talking to someone or your client, and let's say you're talking to someone last year, we try to do a lot of trainings to educate brokers about LIS level 4, but you may not have received this information. But anyone whose income, like I mentioned earlier, if their income is 150% of the FPL, so 136 to 150% of the FPL, they are eligible for a for a level 1 copay. So we were talking about, remember how we were talking about the prescription copays would be $4.50 for generic and $11.50 for brand. An individual would be eligible for this. In years past, they would have to pay a deductible, 50% co-insurance. You would always hear, 75% subsidy assistance, 25, 50%, all that. But that is eliminated because when you're talking to a beneficiary doesn't know, they don't know what 15% is of a prescription. It may change. But having a flat rate is beneficial because you're able to say, Miss Betty, your prescription is going to be $4.50 for that generic. It's going to be $11.50 for that brand name prescription. And the giving them that peace of mind is so nice because they're able to understand that they're not going to be in not going to be in a situation where they can't afford the prescription. Like I was talking to you earlier, there's a lot of folks that go to the pharmacy and they're not able to pick up their medication because they can't afford the deductible, let alone the copay for that particular medication. So this is the one part that's going to be really important to note. So as you're talking to someone, ask them, what is the income limit again for, what is your income? Because that's something that's going to be really helpful to know. What is 150% of the FPL? So for 2024, it's going to be $1,883, so $1,883. So if someone is single and is below that amount, that's going to be 150% of the FPL. Now, for a couple, both on Medicare, if their income is below $2,555, they will be eligible for LIS level 4. Okay, so their copays once again will be $4.50 for generic and $11.50 for brand. Now, the other one that I want to talk about is level 3. A lot of folks get confused, and I don't know why they decided to make them that way. You know, LIS level 1, LIS level 2, LIS level 3, LIS level 4. LIS level 3 does not have an income. So it's not income related. This is for folks that are institutionalized. So someone that is is at a skilled nursing facility, or if they're on long-term, on full benefit dual eligible. Here in Arizona, this is known as long-term care. But if they're a full benefit dual eligible individual, then they will get the prescriptions at a zero cost for both generic as well as for brand. And so usually beneficiaries it will throw someone off when they encounter, agents usually get thrown off when they encounter someone that has LIS level 3. Now, this is something that, if they are eligible, they could enroll into a dual special needs plan for those individuals that are, for those plans that are full benefit dual eligible. Now, one of the things that's also really important is the benchmark. So remember how I was telling you earlier that CMS will pay a Medicare's beneficiaries plan premium up to the state's benchmark. So if the benchmark exceeds that amount, then the beneficiary may have to pay out of pocket. But still, it's a big reduction than what having to pay full price for their premium. So usually you'll hear in years past, LIS lookalike plans and so forth because of that particular reason. Now, sometimes we always hear, agents always say, well, why was my client's prescription drug plan changed? They liked the plan that they were on, but somehow they got changed to another plan. The reason why that happens is because if that particular plan had a change in their plan premium, which exceeded that state's benchmark, then that individual could no longer stay on that plan. So they would have to then be auto-enrolled to and changed to another carrier. And that's the reason why that occurs. I think someone asked a question.
Yes, we have a couple of questions in the chat.
Okay, sure.
So Sherry was asking if there is a place where she can easily find this information for reference. And Nawab asked if in Illinois, he says, LIS is only one level here in Illinois. That is correct. So I think that if it's okay, I'm going to just let everyone know I put into the chat, and I'm going to put it in there again, the link to the Medicaid.gov page that will link to your specific state, that gives specific state information. But Manny, did you have anything to add to that?
No, you're right. Certain programs, certain states have different provisions with regards to their LIS, as well as to the Medicare Savings Program, as well as some of these programs that are applicable. And for Arizona in particular, there's no income and no asset limit, and so we have a lot of folks that may no longer wouldn't be eligible for LIS because their assets exceed the asset limit, but because they apply for the Medicare Savings Program, they are eligible for LIS. So Illinois I'm really excited to hear about that they offer only an LIS level 1. So that means that state is above. But usually, do you know what the co-insurance is, Nawab? Just for sake. Correct. Russ, every state has their own benchmark. You are right on that. So the benchmark, as you see here, the state with the highest benchmark is not surprisingly is New York, $48.72. And the state that has the lowest is not surprising also is Texas, $28.37. Here in Arizona, we're at $43.18. So this benchmark, depending on what market you are in, if you, some of you are in multiple markets, it's really important to note this, because what's in, if you're talking to someone in Texas, it may be a big difference. And if you have someone that is moving from another state to, let's say someone's moving to Arizona, it's really helpful to educate them about that, because that way at least they have an idea. Now, a lot of folks are not aware of this, because once again they just get original Medicare, and they enrolled in a PDP or a Medicare Advantage or a supplement. I was talking with someone the other day, and actually I was listening to a sales call, and the person was new to Medicare. They're like, I'm not going to enroll into a prescription drug plan. I can't afford it. They aren't aware that there are these programs. There's LIS. The person is definitely eligible for LIS, but he was not aware of that. He just thought that, I don't take a prescription, I shouldn't pay for a Part D plan. So this is something that's really helpful and will be beneficial as you meet with clients, especially as the year as the year passes. In 2024 there are some really exciting changes. And then 2025 is even better. So that's something that we'll touch a little bit on that as well. Now, how does
Awesome.
my client? Yes, you have
I was
questions?
just going to say
Yes.
that is really great information. I want to let you know that we are in the last part of our webinar series, because we do have a commitment to end before the top of the hour. So I know you have a lot of great information. I just wanted to let you know so you could pace yourself.
Okay, perfect. Yeah, we're almost at the end too. So how does my client apply for LIS? It's simple. They can either go through the Social Security, apply online, or they can also call Social Security. They can call 1-800-772-1213. They can make an appointment if they don't want to be put on hold. Or they can also apply for state Medicaid programs such as Medicaid or the Medicare Savings Program. As an agent, I will always recommend, applying for the state Medicaid program, because that if a person is eligible, they could get their Part B premium paid for, and they're not going to be saying, oh, uh, the Social Security did this for me. They're going to say Russ did this for me. You got to talk to Russ. He talked to me about he helped me apply for the Medicare Savings Program, which gave me my Part B premium, so they no longer taking that out of my check. In addition to that, I was able to get a reduction in my prescription cost, usually about a 30 to 45 day period. If someone applies for Medicaid or Medicare Savings Program, Social Security is notified within 30 to 45 days. But that's really exciting, because that will help them, so that way they have additional resources, and more importantly, they're going to be talking to their friends about what you did for them. The other thing that's really important to note is when it comes to LIS, do more research prior to submitting the enrollment application. So if you're talking to someone and they're enrolling into the plan, part of the needs analysis, ask them what their income is, and tell them, the reason why I'm asking about your income is that you may be eligible for additional benefits. A lot of agents don't like asking about income. They're like, that's their personal question. But as a person that's living on a fixed income, they're trying to save every single cent that they can. And agents that take the step further and ask about their income, they are able to keep someone on their book. And more importantly, they're going to be getting referrals from them. Ask them, are they eligible for LIS? If they're not sure, how much do you pay for your prescriptions? They say, I pay about $4.50. Yep, they are eligible for LIS or are enrolled in LIS. Now, Medicare Medicare beneficiaries enrolled in LIS are always eligible for a special election period once per quarter, except during AEP. Now, one of the things I always like to talk about is that if your client was auto enrolled in a prescription drug plan, it's really important to state that, because if what occurs a lot of times is that, especially right now at the beginning of the year, normally what you do if you enroll someone with our plan, I always talk to our agent and say, hey, you know what? On the attestation, if you put on there that particular, so for example, we have someone that became eligible for Medicare in December or January, but they were auto-enrolled into the prescription drug plan, so they did not choose a drug plan. It may provide you with an initial payment of your commission. So instead of getting, an unlike plan type change, you would be eligible for the $611 initial payment. And we've had a lot of agents that are like, wow, I wish someone would have told me about this. I've always clicked on, I have LIS, and lo and behold, I could have got a higher commission check, even though no one's in it for the money. But that is something that's really helpful. In case you don't know, I would encourage you to ask your carrier, especially when you're submitting your enrollment application, check to see if they have any, if they were enrolled into a PDP, and if they were auto enrolled, I would mark that on the attestation, and it's a simple check on behalf of the carrier. Now, questions. We're going to go past the questions because some of you are asking questions regarding the chat. Medicare General Enrollment Period. Now, Medicare General Enrollment Period began January 1st, so it goes all the way to the end of March 31st of 2024. Now, Medicare coverage will begin after the application is submitted to the Social Security Administration. In years past, it would become effective on July 1st, but that all changed last year. So if someone chose not to get Medicare Part B because of whatever reason, they are eligible to enroll in Medicare Part B right now. Now, if someone is on Medicaid, this is something that a lot of agents tend to miss all the time. Doesn't matter what part of the country you are in. If someone is enrolled in Medicare Part A and they are enrolled in Medicaid, they didn't contribute enough, to Social Security. They were shy, either less than 30 quarters, or they were shy under the 40. They only had 38 quarters. They missed it. For premium-free Medicare Part A, they are eligible for the Medicare Savings Program to pay for their Medicare Part A. Now, remember, I talked about the increase in income. That's really important to note because you only have 2 months to talk to these individuals and try to help them to get enrolled in Medicare Part A or in Medicare Part B. If you wait until April or May or anytime, after March 31st, unless they have a special election period, meaning that they were recently dropped due to Medicaid eligibility, um, then they will have an SEP for electing into Medicare Part B. But this is really important to note. A lot of agents become aware of the Medicare General Enrollment Period when it's too late, the last week of March. But this is something it's really easy to fix. And more importantly, the folks will give you referrals. I've had agents that are, that are working on this right now. And, it's a really easy process to get someone enrolled in Medicare. Well, it's not really easy. But if you have guidance, it's really simple on how to do that. And you can ask your carriers, whoever you're contracted with, about guidance on how to do that if you're not familiar. Now, um, one of the things that I want to share with you is the Medicare Part B application is real simple. I always tell folks to get this and take it to the Social Security office or fax it into the local Social Security office. Don't fax it into the National Security office because it can take a while. Medicare Part A application is simple. Common errors within the Medicare Part application is that usually there is no witness, and that can prevent the application from being processed. If someone is enrolled in in Medicaid, you don't have to put on there that you're applying for conditional Part A because they are already enrolled in Medicaid, so it eliminates that process. One of the things that's really important to note is do it. If someone is applying, tell them to go and apply now. Don't have them wait. A lot of times folks will say, I'll go next week, I'll go, 2 weeks. If they are approved for Medicare Part A or Part B, depending on what their income is, if they're on Medicaid, they will be eligible for a dual special needs plan. If they're on, not eligible for Medicaid, then they would be able to enroll into a Medicare Advantage plan. And more importantly, if their income is below that income limit, remember we're talking about, QMB, SLMB, or QI1, then the state will pay for their Part B premium. Most important, yes.
Manny, we have a question in the chat. Leanna asks, What information do they need to bring if you're going to help them apply for a Medicare savings program?
Very good question. So depending on the state, they will just need their award letter from Social Security. Some states will require if they have any additional assets. Like for example, if they have a second house, if they have bank account information. I always tell agents to provide 3 months of their most current bank statement. Because that way it gives an idea. Now, if there is a they're going to may be asked a verification of deposits. So if there is deposits, let's say for $100 here and there, like sporadically from, like second Friday of every month, they're getting $100. They may be asked for a verification deposit. Where's that money coming from? Is it coming from a son that's depositing money or paying them for whatever services that are rendered to them? They may have to get a statement, but that's just what they may need. For states that don't have an asset limit, then all they need is their Social Security award letter. A very good question. It doesn't take that long to apply for Medicaid as well. If your client receives a letter regarding their Medicare effective date, remind them to call you. This is very, 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 very important. I've had clients that have gotten the letter stating that they owe $1,300 because of their Medicare Part A premium. Because once again, when someone applies for Medicare Part A, they're going to have to make payments 3 months in advance. Because it's in order to get their Part A started. But if they get the letter, what you want to do is you want to call the Medicaid office if they are on Medicaid, so that way the state starts paying their Part A premium. You're going to get a code from Social Security when that occurs, and you got to notify the state so that way you can get that Part A premium paid for. Same thing for Part B. There's a lot of folks that are choosing not to get Medicare choosing not to get Social Security because they just want to hold off a little bit. They will also get a letter saying that they have to pay their Medicare Part B premium in advance. So if they are enrolled, if they're enrolled in the Medicare Savings Program, or if they're not enrolled in the Medicare Savings Program, you want to let them know so that way you can help them and get that squared away. Now, let's see, that's about it. Okay. I want to thank you again for this opportunity. If you have any
Many,
questions, yes.
many. I have question. So
Yes.
I have client that don't have part A, only have Part B because he never worked for 10 years for Part A. Can he get
Yes.
it? It's on
Yes.
Medicaid.
Well, he's on Medicaid right now, Laurencia?
Yes.
Yes, he can get it.
How?
He's going to have to apply for, how I was showing the Medicare Part A application. He has to fill this out. Okay. Some of the common errors on the Medicare Part A application, it states, like for example, enter dates of employment. Because he has Medicaid, he's just going to have to answer the question 6A, where it says, "Do you have
6A?
Medicaid?" Yeah, and then he's going to
Yes.
mark yes, and then he's going to go to question number 7. He's going to sign it. Common error, what folks will start doing is they'll start filling out questions from 6B all the way down. Don't have them fill that out. If he's applying for Medicare Part A, you're also going to want to put on there that you are a witness, because if you don't put that you are a witness, what they're going to do is they're going to want to do a video conference. If he does not have the ability to answer some of those questions, it may complicate it. So I will always encourage folks to, sign as a witness, so that way it doesn't
So,
hold up the application. But it's a very simple process, Laurencia.
so you means just filled out 6, the number 6, that one tell us about current and health coverage and benefit.
Yes, so you're gonna have them fill out all the questions up to number 6, where it says, do you have Medicaid? And
Yeah.
it says people with Medicaid can get help paying for their Medicare premiums. You're gonna mark that yes, because if he already has Medicaid, and then you're not gonna answer question 6B, 6C, 6D, 6E, 6F, 6G, and 6H. You're not gonna answer those questions. You're just gonna sign the application after answering that question.
Only write down Medicaid, and then when they work, no need to answer.
No,
They don't have work.
because they didn't contribute enough. They already have that information. They didn't work enough to get Medicare Part A. Lorenzo, a lot of people, they take advantage. They once they learn how to do this, I mean, they're going to tell everyone about what you're doing for them.
Mhm.
and it's really helpful. But a lot of folks miss this opportunity. But very good question.
How to get this application online?
You can go to Social Security, or you can also get it online. What state are
So
you in, Larissa?
New Mexico.
New Mexico? Okay.
Yeah.
So yeah, you can go down to the Social Security office, and so if because you're in New Mexico, you're gonna want them when they get approved for that, you're gonna want to notify Centennial Care so that way they can start paying that Part B premium for you on your behalf.
Not Part B. Part B.
Excuse me,
Part A.
Part A premium.
Part
Yeah,
A.
Part A premium. Correct.
What's the
Yeah.
form name? That one. The application for what? The form name, the one that you just showed me.
Oh, it's the
Application for Part A.
I could I don't have it with me right now because I cut it
Yeah,
off
this
and I
one, right?
put it on the
Application
printer.
for Part A,
Yeah,
hospital insurance.
yeah, yeah. Mhm.
And then I have one more question. For
Yeah.
LIS, I have client on level QI1. What's
Uh-huh.
the income maximum?
For QI1,
QI1
so
single.
okay, so this is going to be released tomorrow, but the income for QI1, is there a single person or married?
Single.
Single is going to be $1,694. And now we're going to add the $20 income disregard to that, Lorencia. So that income is now going to be $1,714.
So what is the one that you just write down in the handout? 1,883 month.
That one is for 150% of the the FPL.
So I have to see the 1,694 plus $20. That one, the exception.
For QI1. So QI1 will pay for their Part A, the Part B premium. Now, when you apply for Part B, so let's say you're talking to someone, they get approved for Medicare Part B effective February 1st. What you want to do is you can ask for a retroactive coverage. So the state will go back 3 months, and they'll get that Part B premium added to their Social Security check. That one I always like doing. So I always tell agents, if your client gets approved for Medicare Savings Program,
Yeah.
they in their SLMB or QI1 ask for retroactive coverage for the last 3 months. It's not available for QMB, unfortunately, but it's only available for SLMB or QI1. But very good question.
Hey, Manny. Manny, it's Raul, Arizona. How are you?
Hey, Raul, how you doing?
Pretty good. Hey, thanks for all the great information. This is awesome.
Oh, you're
Um,
welcome.
I just want to clarify something real quick on the, somebody didn't work enough quarters. You said Part A or Part B. If they're on Medicaid, they're eligible for Part A and Part B.
Correct.
Okay. Is that so that they have to be on Medicaid or here in Arizona Access, right? They have to be on Medicaid. Is that emergency services only as well, or just?
No, emergency services, they're not eligible for this program.
Gotcha.
Yeah.
Gotcha.
They have to be
Okay.
on Medicaid. They have to be enrolled in Medicare Part A or B.
Oh, they have to be enrolled in Part A or Part B to get one or the other.
Correct.
So
Got
what happens if in the future they no longer become qualified for Medicaid? Do their Part A premium becomes payable by the consumer now, by the beneficiary?
Very
Or they
good
just
question.
drop them immediately?
Very good question, Lee. So what will happen is they'll receive a notice. They'll say, hey, Miss Betty, here is your statement. You owe 3 months because the Medicare Part A or Part B will have to be paid 3 months in advance in order for them to continue getting it. If they don't have the money, which a lot of people will not, unfortunately for Part A, what will happen is that particular benefit will go away. They won't owe that money. They're not going to get sent to collection. It just goes away because no premium was paid for. That plan is no longer eligible. Now, there are, I'm glad you actually brought up a very good question too. It happens. It happens a lot, especially with, they start working and then they stop working. So let's say, for example, they start working and they lose their employment, in which now they are eligible. They can apply for Medicaid, and they can also apply for Medicare Part A or Part B, and it would be a special form that they would have to complete.
Okay, even upon renewal, because I've had people that they tell them they get their Medicaid renewal and they just think that it just automatically the state's going to do their part, and they don't. And so if they
Correct.
drop them, they have to go reapply, and they can take a process, but it can be back reactivated by their Medicaid benefits once they get recertified again, correct?
Correct. Right now, because of the redetermination, is once again, this applies nationwide.
Mhm.
There's a 90-day look back period in which they happen to lose, they forgot to renew, they can get reinstated up to 3 months prior. So if they lost it in March, they'll backdate all the way to December.
Yes.
One of the things that's really important to note too, if you're talking to someone that's new to Medicare, a lot of times they may not have the Medicare Savings Program. It's a simple fix. Call your carrier. You can verify eligibility. If you contracted with the dual special needs plan, they can verify their eligibility for you. And then that way you're able to explain to them. A lot of agents will sometimes say, oh yeah, now that you're on Medicare, you're on Medicaid, the Part B premium is going to be paid for. And all of a sudden they're like, what's happening? My Part B premium is being taken out of my check. And this all will end once the redetermination period
As soon as
ends.
it's over, yes.
Those are some of the issues that are coming about right now.
Yeah.
A good
And
question.
I had to research it because I had some clients coming back to me when I helped them get on their Medicare Savings Program, the LIS, and then all of a sudden they get some of my carriers will actually redo the 3-month look back, and then all of a sudden they get a letter from Social Security, hey, we owed you some money, and then
Mm-hmm.
I was completely unaware, and then they come
Yeah.
to me, so I had to do some research. I'm like, oh. And then, I mean, I didn't want to take, I said, I kind of want to take credit, but I don't, because I honestly, at first, I'm like, I did not know, but I'm glad you got some money.
No, yeah, I had clients up in New York, and when they would get a check, because New York takes a little bit longer to process the Medicare Savings Program, they'll call me back. They're like, Manny, I just got a check of about $1,000. I think it's some kind of fraud, And I'm like, no, that's your money. That's your Part A premium, because I mean your Part B premium. It just took the state 8 months to process
give it,
it, but
to
that's
give it to
your
you.
money. Yeah, that's your money. Oh my goodness. They're like, oh, this is gonna be
Yeah.
Christmas,
And I've had more people come to me because now that I understand, then like, hey, this is the way it works. Oh, okay. Okay. So now,
Hey,
yeah,
Manny, Manny, does
Yeah.
Medicaid also pay the Part B penalty?
Correct.
They do.
They'll pay the
Okay,
Part B
good.
premium, so the penalty. So if they are, how, people, 10%, they forgot to enroll when they
Mm-hmm.
had the opportunity, they'll pay that Part B premium.
Okay, I have a gentleman, like I said, 13 years he didn't have his Part B since he became eligible for Medicare. Then he finally needs, Part B. So we apply, and they told us at the Medicaid office, no, he's not eligible for the penalty, just for the premium, which I didn't think was correct. But anyways, that's offline.
Well, those are questions that I like, because you normally have to talk to a supervisor in that aspect and explain to them. Unfortunately, with everything, customer service can
Yeah,
falter at times, and so they just may want to talk to a supervisor to get that corrected.
gotcha. Awesome.
thank you.
You
Thank you,
eased my
sir. This
mind
has
there.
been very, very, very great information.
Manny, we have a
Well,
few questions in the chat that I want to
oh,
get to before everyone logs off. This is Marisa, your
okay.
chat monitor.
Okay. All right. Sorry
I'll
about
make
that.
sure we answer these. That's okay. One is, how do you prove years paid into Social Security? So I think that's going back to when we're talking about applying, I'm assuming.
Yeah, so Social Security will have that information. I mean, they will pull they should get a statement, and they will be able to prove, show you, hey, this is the amount that you paid. There have been some circumstances where, due to identity theft, you might see something that's not yours, and it's sad to say,
Right.
but they'll be able to verify that information for you.
Okay.
Good question.
No, they can bring their pay stubs, but Social Security will pull all of that.
Yeah, because they'll be able to pull their what they contributed to Social Security during that time.
Great. I'm going to jump to another question here. Is the income used gross or net of their Social Security income in order to apply?
Very good question. It's going to be gross income, the amount before any deductions from either Social Security or any type of garnishment, whether it be a fine, alimony, or anything like that. I've had folks that say, I only get $600 a month. How am I going to live? And I'm not eligible for a Medicare Savings Program. Well, they also owe $800 back pay for someone and something. And so it's going to be a gross amount. Very good question.
Okay. Yeah, these are not my own questions.
Okay.
These come from our very knowledgeable agents. And then the last one we have in the chat is a circumstantial situation. A wife has been dual For many years, the husband's on Medicare, but not dual. He now has Alzheimer's. She's always claimed to be single. Would he qualify if he applied for Medicaid?
You would have to go back and check to see by any chance, are they legally married? There's a lot of folks that are, that they claim that they're married, but they're not married. They just live together for so many years, and they just say, "Wait, common law." Depending on the state, common law is normally not recognized, especially when it comes to these programs. And it makes sense because, it can make a difference. Yeah, yeah. It can make difference. It can make a difference, and so there's a lot of folks, believe it or not, that will get divorced. They live together in order to be eligible for. I don't really recommend that, but that does happen, unfortunately, because once again, you go back to the cost. They can't afford the cost of living. Cost of living, for example, will increase, but that cost of living goes away with the Medicare Part B premium increase as well. So it's like it's hard for these folks to make it by. But I would just um, I would just just say, hey, you know what, are you really are you single, or but if they claim that they're single, they could apply. If the state says no, we have you as legally married, then at that point they would get a denial notice.
Many. I have another
Yeah.
question. So that one, the application for Part A should be done on January 1st until March 31st only, right?
Correct.
After that, no more.
Correct. The
Mm,
common folks will a lot of folks will apply in September, October, November, and their application is denied. You don't know how many times we hear people that said, I applied for Medicare Part B, I was denied. Well, when did you apply? Well, in April. Or, okay, yeah, you missed the cutoff point, unfortunately.
So
And
you
so
mean
things like that.
either Part A and B has to apply January 1st until March 31st. Part A and
Correct.
B.
Correct.
Mm, okay.
Yeah, I have clients that I've talked to them, like, because you'll talk to clients during the year. You may get a call from someone and says, hey, I have Medicare, but then you're like, oh, you don't have Medicare Part A. And I will tell them, hey, save it on your calendar. And sure enough, they're calling me in December wanting to know if they could apply for Medicare Part A. And it's like, no, you got to wait till January 1st. Because even if you submit an application in December trying to beat the system, it will get denied.
Okay. And then for QI got rejected, and then how to apply again? Go to Medicaid office?
Correct. No. QI1, you're going to apply through the state Medicaid. Okay. So let's say, for example, there's folks that were kicked off of access because of kicked off of the program because of the cost of living adjustment that occurred in December. So folks will say, hey, you know what, January 1st is here, your income exceeds the income limit, you're no longer eligible for Medicaid.
Yeah.
Well, February 1st, you're able to, tomorrow, that person is able to reapply for Medicaid, and if their income falls within the income limits that I just shared with you, then they would be eligible for that program. And
So
and believe it
reapply.
or not,
Reapply to Medicaid, right? That one. Yeah.
correct. And
Okay.
we've had folks that had we've had folks that before the income limit wasn't released until April 1st, but since 2019, that income limit is now being released February 1st. So that's really neat, because before people would have to wait 4 months without Medicaid coverage or assistance with their Medicare Part B premium because their income exceeded that amount. And then April, they will then have to reapply. So I'm really excited that the FPL is being released a lot sooner now.
Okay, that wraps up our time for today's national webinar, but I truly want to thank you, Manny Felix, for not only sharing your time and your expertise, but also all of the great information that you shared with us today. It was exceptional, and as you could tell from all of our questions that we had today, it was needed information, and we are so grateful that you were here to share. For those of you who have joined us today and gave your time. There will be a recording that will be sent to you so that you can review, make sure that your questions were answered. If you have additional questions that maybe haven't been answered, or if there's anything that we can do for you here at Fidelis, we want to encourage you to reach out to us. I do have the email address and phone number up on the screen for you. Feel free to screenshot, take those down. And I want to thank you on behalf of all of Fidelis and Manny for joining us today. When you close today's session, you will have a survey that comes up. We'd really appreciate your feedback. Just let us know if the content today that was shared was helpful to you, and anything else that we can do to just make your experience helping those out there in the Medicare world a little bit better. Thank you for your time, everyone. Have a great day.